I just want you to see all this lamina propria is dense collagen bundles. And right here where I'm making little marks, that's where they attach to the tooth. And then along here, that's where they attach to the bone. Now notice when I get to the MGJ area, look at the, up here, there's a lot of blank spaces. That's where the submucosa is. And kind of in between this mucosa, this bone and the submucosa, there's a little bit, that's actually a little bit of a muscle attachment coming up there too. But up here in the gingiva, this is all lamina propria directly attached to the tooth right there, directly attached to the bone right in there. And then this alveolar mucosa has a loose attachment in here. Okay, so part of this is just a continuation of what we talked about last week when I went over the differences between the gingiva and the alveolar mucosa. We talked about differences in the surface epithelium, which you can see here, and then differences in the connective tissue. So this is just this part is what you would have to recognize on a slide next week for the as part of the test. And then all of the stuff that pertains to the dentogingival junction, all that, as we're going to build on this picture and add to it, that is not on the test. So let me just clarify that. If I just pointed to this and I said, is this the gingival epithelium of the gingiva, the alveolar mucosa, or is it the lamina propria of the gingiva or the lamina propria of the alveolar mucosa? What's the correct answer? Melissa?
Can you repeat the question? I got like lost in the middle of it.
Okay, I'm just saying that you have to, in this slide, next week's quiz, you just have to recognize the parts of the gingiva that make up the oral mucosa. Remember, the oral mucosa, it's the only part that makes up the oral mucosa portion of the gingiva is the surface epithelium and the lamina propria. So if I pointed to this versus this, you would just have to be able to tell that this is the surface epithelium of the gingiva, this is the lamina propria of the gingiva.
Okay.
Or I could point here and say, what is that? That's not the epithelium of the gingiva, but what, Melissa? The epithelium of the
Mucolabial fold?
Yeah, the alveolar mucosa. And then this would be your lamina propria. And where I drew it in, where the white spaces are, that's the
Submucosa?
So you'd only have to distinguish, like you'd have to just be able to tell that, you know, from here to here, that's gingiva. And where 1, 4, and 5 is, that's the alveolar mucosa. Okay?
Okay.
All right, so let's add to it now. And we added, we put the gingival crest down. Let's add the sulcular epithelium. And like I said, compared to, first we have to find the sulcus. If here's the crest, here's the enamel space there where the tooth is. So right in here, that's your sulcus. That space right in here. So see how that looks like hardly anything compared to on the diagram that you labeled. So lining the sulcus is what, Tiffany?
The sulcular epithelium.
Okay, good. And right here, this is the base of the sulcus. And if I draw an imaginary line out to the surface, remember that correlates to what, Elia? What does the base of the sulcus correlate to what landmark on the gingiva on the outside?
He texted me that he went to the bathroom.
Really at the base of the sulcus, and I go out to the outer aspect of the, just think this is everything above coronal to this line. Everything coronal to this line is not attached. So in between the pink lines, that's the free gingiva. And then when we go, what's that landmark that sometimes doesn't show up well on patients that is equal to the base of the sulcus? What's that landmark that separates the free gingiva from the attached gingiva?
It's the gingival groove.
Okay, free gingival groove, good. So right where I drew that line across there, that's the free, that would, or that right where I put this little mark right there, that would be the free gingival groove. And see, from the crest to that groove is the free gingiva. And if you look on the tooth side, that's where it's not attached. There's a sulcus there lined by sulcular epithelium. Okay. On the outside, you know, the gingiva continues as the attached gingiva. When we look on the tooth side now, here's the base of the sulcus. And then all the way to the CEJ on this particular tooth in its socket, all between there, this purple mark there that looks like a comma, all of that is your junctional epithelium. That's all. So it looks much greater on this slide. So the yellow is your sulcular epithelium, and then attached to the enamel here on this case, this is actually an example where it doesn't go down on the cementum really. It doesn't really extend past there. So in between these lines here, that's where the junctional epithelium is. And then where I already drew the little blue horizontal lines, that's where the dentogingival fibers attach to the tooth. So now if I go from the base of the sulcus and to that alveolar crest, in between those boundary lines, that's where your dentogingival junction is. And again, if I draw that, there's where the junctional epithelium is attached, and then the dentogingival fibers are attached there. So all that light blue line again shows the attachment of the gingiva to the tooth. So just think, what tissues attach the gingiva to the tooth? Junctional epithelium and the dentogingival fibers. So where the black bracket is, that's the dentogingival junction. And all of that is attached gingiva. All of that's attached. And you see how that's roughly, if I go back to the outside here, that's roughly where my MGJ is. So all of through here, there's my attached gingiva.
So the big dark blue bracket, that's the attached gingiva, right?
Right. So all between the blue, this light blue bracket is the attached gingiva. The pink is the free gingiva. And I'm just having you see that on the tooth side, because on where the free gingiva is on the tooth side, I have a sulcus lined by the yellow sulcular epithelium. It's not attached. And then from the base of the sulcus all the way to the crest, that's where I have the attached gingiva is attached to the tooth. And it does go down a little bit on this facial aspect of the bone too. The gingiva is attached to bone too, but we're just talking about the attachment of the gingiva to the tooth all along here. And then the gingiva is attached to the alveolar bone right along here. And then it's going to transition into the alveolar mucosa. I'm just drawing a imaginary line there. Here, that turns into the alveolar mucosa. And I have surface epithelium of alveolar mucosa, number 4, lamina propria, number 5, submucosa. Okay. So let's go to the second page and look a little bit more at the blow-ups here. Oops. So we're taking the area that's in the black box and blowing it up on the second page. So I've got to stop